Hello, everyone. Thanks for joining our webinar today. AI is replacing busy work, not people. I'm excited to introduce Dr. Anish Kapur, our founder and CEO of Promptly. As both a physician and an entrepreneur, Dr. Kapur has dedicated his career to building technology that works with healthcare teams. His focus has always been on reducing friction in the patient experience, so specialty practices can spend less time on administrative tasks and more on patient care. Today, he'll share how AI is helping healthcare organizations automate the busy work while keeping people at the center of care. Dr. Kapoor, thank you so much for being here, and I'll let you take it from here.
Thanks so much, Sam. Hey, everybody. Good morning. So today, we're talking about how AI is replacing busy work within practices, but not replacing people. It's one of the biggest concerns that people have as they start, looking into AI solutions. What is going to happen to my staff, and then the staff, understandably, also worries about like what's going to happen to my job. How is it going to? How are things going to change? And what jobs are going to be left, depending on what AI gets rolled out. I want to talk about how we're not going to be replacing people with AI as much as we are going to give them the tools to make their jobs easier. And dive into a few different areas that we've seen practices work with us when it comes to AI within their practices and their workflows. So just again, to start off, AI, especially at this stage, it's not determinate. It's not going to come and just destroy all of the jobs that are currently operating within the medical space. At this point, almost 70% of groups have not eliminated or redesigned roles due to AI after installing them. What they've been able to do, though, is have people more focused on what the right experience should be at the practice and what's an ideal workflow. A lot of the systems that we have in place, and again, this can be anything from practice management systems to EMR systems to ancillary systems to payroll to just everything that it takes to run both a medical practice and a business, being one and the same. Those can be very overwhelming and take a lot of staff to run. And so in using AI, you can see that we can not only invest in this technology specifically to retain our workforce, especially as prices get crunched and it gets harder to keep talented people, but also looking at automation, right? So there's definitely like two schools of thought, and I think both work in parallel, right? We have overworked staff who have a ton of different responsibilities on every level, right? And then we also have a ton of manual processes, either from the systems that are in place or just from this is the way that we do things, right? And so both of those can be true at the same time. And I think that is where a lot of practices are coming to say, okay, well, like, how can we use AI? And I think that a lot of the like noise and fear and the different like hesitations around AI is, and I see this every time we start talking to a practice about it, is they start listing different things, saying, can't do this, can't do this, can't do this, can't do this. So like what I want to do first is just frame the technology, right? Like, because I think that a lot of people will zoom in too much or zoom out too much, and it just kind of loses perspective there. So as we talk about AI, I want everybody on the call to just kind of like close your eyes for a second and imagine that you have hired a remote employee who will follow all the rules that you set, not take any days off, and not give you a call and give you a hard time about it. Now, open your eyes. And that is what an AI agent is. It's a remote employee that is going to be doing rule-based tasks on whatever framework that you've set 24 hours a day, over and over, right? And the way that I like to tell people to initially think of, okay, what can an AI agent do at my practice, is to think about RPA. Now, RPA is an older technology. It gets downplayed a lot now, and it's something that a lot of people don't want to talk about now because it's kind of the infant stage of what AI would eventually become. And RPA stands for robotic process automation, right? And frankly, it's if this happens, do this. Simple, right? So if you start with that, then you can expand how you're going to frame it in your mind from there, right? So if you say, okay, every time this happens in my practice management system, I want the agent to execute this order. Great. So if this, then that. If this, then that. That's RPA, right? That's something that's like pretty robotic, pretty simple, right? And that's kind of like what I say as what I like to tell people is the first layer of what AI automation can do, right? It's incredibly basic. It's been around for a long time, right? But then what AI has done is add intelligence to that RPA to make it even stronger, right? So at its core, if you take RPA and you say, okay, if this happens, do this, right? That's very repetitive. It's strict rules-based tasks mimicking like humans clicking and entering keys, right? What AI has done is now added intelligence to this, right? So it can learn, it can reason, and it can adapt, right? So previously, people would have problems with, okay, I'm trying to do this task, but if fields change or it is asked, the screen pops up asking for more data, or I need to do this next level step, something that's a little bit more complex and a little bit more unpredictable, that is where AI it comes in, right? So if you think about it in the sense that like RPA, it like used to basically just mimic hands, right? Just doing what's told without deviation, just the hands, click, 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 move the mouse, click, and go from there. While AI now has added a brain to that, right? So not only can it go through all these actions, but it can decipher context and it can actually make reasonable decisions within whatever guardrails you set, right? So if you think about something like an authorization request, right? You say, okay, if these rules are fulfilled, so it's a patient who's coming to see a provider for this type of procedure or this type of visit, and they have this type of insurance. Well, we want you to go to do to get a prior authorization. Now, that is going to be, that, okay, if this happens, then that happens. But then the artificial intelligence on top of that will learn all the operational rules that you've set, just like you would train a new employee, a remote employee. And then, so as it goes through the different steps that are necessary, it's actually is reading the context that's on the screen and it's making the right decision on what information it needs to pull from your current systems into that payer portal or whatever else, getting all those results and bringing them back and notating it the way you want it and so on, right? So it adds that extra intelligence on those if this then that task workflows, right? So one area where this is like pretty easy to see things get automated and just become an easier tool set for the practices that are dipping their toe into AI is facts. I'm sure everybody's thought about it at some point of how is fax still a thing. Everyone thought it was going to go away in the 90s. Everyone's thought it was going to go away in the early 2000s, and it's still here, right? And it's still one of the primary methods that we use for communication between medical practices, be it actual paper fax or be it an e-fax, either way, right? But it's funny when people try and talk to me and say, do you think that AI is going to replace all the jobs and in healthcare and so on? A lot of times I say, well, we haven't been able to get rid of fax. The chances of us updating all of our systems to the point where AI can take over things within the healthcare space seems pretty far away, right? So at the end of the day, when your physician liaisons are out there and they're meeting with all the different physicians within your referral network, you start getting all this paperwork, again, either digitally or actual paperwork through fax, right? Either through an e-fax service or through a fax machine. And then all of that has to be extracted and put into your systems and sorted, right? We've worked with the Google Gemini team and have created systems where we can instantly extract all the information from the fax and separate all the multiple stacks, right? Because a lot of times when a practice is going to fax, referrals or whatever information to you, they stack a whole bunch at once. So, being able to automatically sort that, being automatically able to, decipher which pages go with which patients, and then pushing it to your EHR and practice management systems cuts down a ton of time. On average, especially clinics spend somewhere around 3 to 4 hours a day just sorting and retyping faxes, right? And I'm sure a lot of people on this call, you have somebody who's like, that is a lot of what they need to do, but they have other responsibilities as well, right? If we can drop all of that to less than an hour, right, to just 30, 45 minutes, then why wouldn't you take that time back from an expensive employee who's in the office with you, right? The AI is instantly pulling those patient details, even from doctor's handwriting. We've done extensive trials to see if a physician's handwriting can be read by the AI, and that's actually why we ended up partnering with Google on their Gemini platform, because they were the ones who could do it the best. So hats off to them. And basically, this allows you to not only get everything into your system, organized, check for duplicates and everything else, but on top of that, have all of it accessible in one inbox. So you could see where all of these have come from, and you can start tracking how long before we get all that information into our system, and we're able to contact the patient, right? Reaching out to them if they're a referred patient, or if they're a lead and they have some more premium services that they're looking into, or so on, right? So now taking this a step further, we've been deploying a ton of different AI agents within our customer base. And the ones that have become the most popular is where that AI on top of the robotic processes have become like incredibly not only intelligent, but adaptive. And we've seen the biggest ROI for our practices. And while these AI agents can frankly be rolled out for any workflow that you design that can be done remotely, these are the ones that we've seen have been the most popular so far. Again, AI is pretty young, but at the same time, a lot of these processes are ones that have been tried and tested, and ones that practices, like I'm sure that are on this call, have seen a ton of organization to them on what they need their people to do. So it made it very easy for us to make agents that can replicate those workflows, and then give them the intelligence to understand, okay, well, if this kind of situation comes up, do this. If this kind of situation comes up, do this. And then also we're going to talk about a human in the loop, where if certain situations come up, you may not want the agent to make its own decision. It should ping somebody on your side, right? Send a message, send an email, send something, create a task, what have you, for a human to give it the last step of information if there's something that's off kilter from what you initially have outlined as the rules for that employee. When it comes to things like prior authorizations, this is where we've seen a lot of practices moving towards artificial intelligence based assistance. It can be used for not only prior authorizations, but referral requirements. It will submit and watch for the authorizations, pre-certification, all the adjudication pieces, and then it can monitor the claims and do denial analysis and management as well. And so different agents can be set to do all these different tasks. So they're just running in the background and they don't slip through the cracks, right? When it comes to things like payment posting, ERA and EFT payment processing is very straightforward. It also can post payments from patients or insurance payments. And even when it comes to things like paper EOBs, they get scanned at the practice and sent to the agent, who will convert them into an ERA and then be able to post them to the system. And same with reconciliation of cash, right? You could take your bank statements and you could take your deposits and what's coming through your practice management system, throw the files into, or give the files to a AI assistant, and then they'll do all the reconciliation as well for you and spit out a report. One that's also become really popular within our eye care groups is drug benefit investigation. Not only can you find out which organization is going to provide the benefit, which is going to provide the best benefit, what's the coding and charge capture instructions, documenting everything, submitting documentation to these third parties, and then also messaging the patient directly about what payment is going to be necessary for them. Same with things like claims auditing or any denial management. So if you think about the tasks that you have within the clinic, especially in the back office, where you're going to constantly have people having to review things, sign off on them, make edits, right? Like that's where it's really ripe for AI to be put in place. And we have a ton of these that are being deployed throughout different clinics in the country. And we see the amount of uptick that they start doing. And then we also talk to the staff. And while, initially there's some hesitation about like, okay, well, like, this is something that certain people are doing. At the same time, these are the tasks that take away from what we really want them to be doing. Like there are, these incredible like billing team members who should be working on much like more difficult scenarios or things that need to take their attention, but instead they're working up denials or trying to get prior authorizations that frankly could be handled automatically while they focus on like things that are going to have a much more significant impact to the practice on the business side. Now, when the other thing that everybody kind of starts thinking about when it comes to AI, especially when you start deploying these AI agents, is like, how do we have control over them, right? Well, the way that they're built is that they're built with your workflow specifications in mind. While they have some brain out, fresh out from the box, at the same time, you put whatever rules and restrictions that you want on them. And there's something called a human in the loop workflow that can be done both on the agent side with a third party and within the practice. So basically, what a human in the loop workflow, truly means, I like to give an analogy of if AI is the pilot, then the humans within the practice need to be the air traffic controllers, right? So you position the AI as like the drafter, right? Like it's creating the appeal letter, it's creating the patient reply, it's creating the clinical summary and getting it ready, and then the human is the editor, right? Anything that fits outside of the rules that you've set or outside of the rails that you've given it enough leeway to be able to, not come to you with every little question, just like an employee at your clinic, right? You give them enough, as long as you can get them to anywhere between 80, 85, 90% confidence, right? If they have that confidence threshold, anything outside of that forces a human review, right? And then those escalation pathways, tripwires, so to speak, right? If a patient uses certain keywords, if certain keywords come up when it comes to an authorization, or when you get a eligibility response, if it sees certain pieces, that's where we want that tripwire to fire, and we want it to create either a task or create a message or do something where a human now has to be involved, right? So like in our experience with like, for example, like something like patient chat automation, right? The system can handle things like road FAQs, right? All the frequently asked questions about directions, parking, and so on, right? But we engineer handoffs for clinical questions, or if they mention that there's an emergency happening or anything else, where that gets routed right to like a triage person or a nurse or somebody within the clinic, right? So within all these workflows, you can build exactly at what point does the AI, say, okay, I haven't reached that 85, 90% confidence. Now let me involve a person to see how do I, address whatever's going on at the time. And then on top of that, is this something that now that you've taught me how to, address this, should I learn this and do this going forward? Or is this something that whenever this comes up, you want to look this over, right? And then so that feedback loop can happen as well, where there's certain things that are like, okay, I didn't see the situation coming. I'm glad that the flag went off. This is how I want you to handle it going forward. Or, okay, this is a situation where I want to get my eyes on it every time, either way, right? And as you kind of approach these AI projects, like, a lot of the governance needs to be done internally at the practice side. So, one thing that we suggest is coming up with like a small AI council, right? And not just IT. A lot of people jump right to IT being in charge of that because of its technology, but like you need like a departmental champion, right? Somebody who's like, okay, this is what is going to, somebody that is going to be involved in whatever that process is. So if it's authorizations or payment posting or something like that, it should be somebody from the revenue cycle team, right? A leader there, and then an operational lead, like the practice administrator or so on, and then IT and somebody who's going to handle the risk and security pieces, right? And a big piece of, especially as AI is evolving, and it's evolving incredibly rapidly, as everybody's probably heard, that these models evolve, and your team should be in the loop, and reviewing all the release notes and understanding any logic changes that are going in place, and talking with your account managers about that, right? Like the best vendor partnerships that I think that we have is they involve like guided updates, right? Where we or any vendor highlights exactly how new features are going to impact a specific workflow, rather than just dumping technical change logs, right? Because like technical change logs aren't going to do anything when somebody doesn't understand how this is going to affect me, right? And then on top of that, like doing a sandbox protocol, we're going to talk about that in a second, but basically when things get rolled out, ensuring that the workflow frictions have been smoothed out and running through what we call a UAT or practice. And frankly, one of the most important pieces is going to be winning the hearts and minds of the staff, and just keeping one thing in the back of your mind. And if you don't take anything else away from this, this is something that I think all practice administrators know really well, but with them, right? I don't know if anyone's in the chat to say exactly what. Does anyone have any guesses on with them? What are your staff really care about? All right, I'll give it to you guys. What's in it for me? Right? At the end of the day, don't pitch AI as efficiency, right? If I work at a clinic and I'm at the front desk, or I'm the RCM team, and I hear I was going to make you way more efficient, it just sounds like a lot more work, right? It should be pitched not as this is going to help us gain efficiency. This is going to help us increase the quality of life of our team, right? And then make it a training focus, right? Train staff on how the tool is going to help them get home on time, and how it's going to stop them from having to remember and keep Post-it notes everywhere, right? How it's going to handle like the drudgery, the data entry, the phone tag, so they can focus on like patient connections and the bigger impact tasks, right? And then one thing that we like to do is also just micro training, right? I think everybody has gotten desensitized quite a bit, and like small, quick trainings, right? And something that's very easy, digestible, right? That shows that the immediate before and after of the daily tasks are going to be crucial. So for example, like when, something like prior authorizations get automated, or when payment posting gets automated, now framing around, hey, this is how the workflow is going to shift, and letting people see that is going to be incredibly important. And then on top of that, the one thing that's incredibly important is to ensure what roles-based access is given to each of these agents, right? These AI agents are going to have the same restrictions put on them as a remote employee would, right? So you would specifically limit them to only access all the pieces that you want them to access to complete their job. But then when you combine that with that thinking layer, then it can go through all those tasks, and it shouldn't dictate. Just because it's an AI agent, they shouldn't have just full access to everything. You should shrink that target of what permissions that you give them away from just in case to this is all that's needed, and that's something that we get through as we continue to fine tune exactly what the agent does through our design and build process. So just lastly, I want to kind of touch on how does this all come together, right? Like this is all great. I want to move forward with some sort of AI agent. How do I do that, right? Well, the process is pretty straightforward. What we initially do is start the discovery phase, in which we say, okay, what problem are we trying to solve here? What actions are you trying to automate, and what are we trying to really have the agent do? And then from there, we build a solution design document in which we go through the workflows just as you're doing them today with people, and then we say, okay, let's see if the AI has learned this correctly. And we have it actually create a document and share it with you and say, okay, if you don't have a guide for this process already, here's one that we've created, and we can share and walk through and say, okay, have we learned this process? And then once we've gone back and forth and made sure that that's all fine-tuned, we develop the agent. We work with the Gemini team and put all those different pieces together. And then after that, we move to what we call user acceptance testing, in which we pick 4, 5, 6, 7 examples, and we let the bot do them under our watch, and we see how it acts, and we see if there's any, unexpected, things that come up that we didn't design for in the workflow, or that it has issues with when it's trying to reason through any new variables, and we try and tackle them. And then once we are happy with the user acceptance testing, we move to the deployment phase, in which we then roll out this agent. And then for the first 2 weeks or so, we will meet, preferably daily, but every other day at the least, and say, okay, at the end of each day, you get a report of everything that the AI agent has done for that day, any errors it ran into, any times that it threw up a flag where it needed a human to intervene, and so on. And then we like to review that to say, okay, can we train this new employee of yours to lower these, right? So, let's say after the first run through, there was 10 different prior auths were given, and it was able to complete 7 of them, and there were 3 that it struggled with. Well, are those 3 things that we could teach it so that we can lower that to eventually get to as close to 100%? And then from there, we roll out and look for the next one. I know that was a ton to go through in a short amount of time, but I did want to open up for any questions if we had any. So just want to say thank you for everybody joining.
Yeah, thank you so much, Anish. This was amazing. There are a few questions. I'm going to start off by reading them off a little bit.
Please.
But for the AI assistants, do those have to integrate directly to the PM or the EHR, or can it?
No.
Go ahead.
So again, if we take that mentality of a remote employee, you would actually create a login for your AI assistant, just like you would for a remote employee. So let's say you want these actions to be done on for let's take prior auths again, for example, just because it was at the top of the list. You want to give them a login for the practice management system, again, with only the permissions that they need, just like a remote employee would. If you say, okay, I'm going to offload our prior auths, and then you also are going to make them logins for the payer portal, and it's just going to work like that, right? Because the AI can read the screen, so there's no actual integration necessary.
Another question: when's the right time to invest in AI?
Honestly,
in the practice,
I think the sooner the better. There's a lot of different opinions on this, but mainly because right now the AI companies are being incredibly generous with the way that things work when it comes to token costs and things like that, because they really want a lot of adoption. So you can kind of get a very good deal from it. As I think time goes on, there's going to be a lot more pressure to monetize, especially on the Google, Anthropic, Claude, OpenAI, ChatGPT side of things. And because they're not there yet, it's a very good time to take advantage of, honestly, the cost. And because of a lot of the processes that medical practices are trying to automate are pretty standard, it's just ripe for it right now.
Great, thank you. Those were all the questions that we have so far. Any last minute questions? I'm looking in the chat. I think we're good.
Awesome. Well, thank you to everybody for joining. Really appreciate it.